Hi, my name's Doug Letourneau. I had a left shoulder Bankart repair and anterior labrum repair. The biggest benefit of having my procedure was being able to get back to my athletic activities 100%, being able to play basketball again, golf, and not have to worry about my shoulder being unstable. I injured my shoulder playing basketball, got tangled up with someone, dislocated it. I was able to rehab it at first and re-injured it, and I decided to go ahead and have the surgery. My initial consultation with Dr. Roos, he informed me I should go get an MRI with contrast. I went and got that done. Followed up with the doctor after that. He told me I had a labrum tear. He said I had a few different options. I could do surgery or I could rehab it. I decided to rehab it because I didn't want to go through surgery. That worked really well for about 6 months, and then I re-injured my shoulder playing basketball again. And Dr. Roos saw me once again for a follow-up. He said you can either keep having these instability episodes where my shoulder would pop in and out, or I could decide to have the surgery and it should fix it permanently, so I shouldn't have to worry about that popping sensation in my shoulder. And at that point I decided it was probably best to just go ahead with the surgery. I had my surgery at ACC, which is the Outpatient Surgery Center at ORMC. I had my surgery at 7 a.m. on a Friday. I remember the day specifically. I remember seeing Dr. Roos right before going into surgery. All the nurses at the hospital were really nice and attending to me. I was able to go and see actually Dr. Roos before the surgery, which was nice, comforting. I also saw his PA, Alicia. She just reassured me that everything was going to be okay. I had nothing to worry about. I do remember going into the operating room and then nothing else from there. But I do remember waking up. The nurses were very nice. I was able to see Dr. Roos's PA after that, Alicia. She said to call her with any questions if I needed to. The first few days after surgery are always the toughest, and they definitely were. I followed up with Dr. Roos's PA, Alicia, a week after my procedure. She took the stitches out, told me what to expect after the surgery, my post-op recovery time. Started therapy 3 weeks after my procedure. The first about 6 weeks of therapy were pretty tough. Throughout the course of therapy, I noticed it started to get better, a little bit better every time I had therapy. And I would continue with my home exercises, stretches, things like that to do at home, and I did notice an improvement over the first 6 weeks. I had a follow-up appointment with Dr. Roos 6 weeks after the procedure. I continued my therapy thereafter for about twice a week for the next 6 weeks. At the end of the 12 weeks of therapy, I felt great. That would put me at about 3 months from the surgery, which is what Dr. Roos told me to expect for 100% recovery. So therapy was very helpful, as you definitely are going to need it after a procedure to regain your strength and range of motion. I felt very good, about 100% after my 12 weeks of therapy. All in all, I'm very glad I decided to have my surgery with Dr. Roos. He did a very good job. I can get back to the basketball court playing basketball, not have to worry about dislocating my shoulder anymore. Back on the golf course, no problem. Even as something as simple as opening a cabinet, I don't have to worry about it anymore. Or getting dressed, I don't have to worry about my shoulder popping in and out. I'm glad I had it 100%.